The use of partial booking is one of the best ways to increase attendance in a trust, prevent cancellation, and make the best use of our booking resources. What does cancellation mean? Well, there are three types of cancellation. Number 1, hospital cancellation. Number 2, patient cancellation. And number 3, did not attend, or DNA. Hospital cancellation is when a clinician, for example, books their annual leave in place of a booked appointment, where patients have already been booked in advance of the annual leave request. A patient cancellation is when a patient informs us they are unable to attend their appointment. Often, this is at short notice and we cannot find another patient to fill the slot. A DNA is when a patient simply does not attend and we have not been informed. So what is partial booking? Well, it's probably best to start with the usual process. When a booking is made in full, the patient will be booked in to the next available appointment time slot, if it's under 6 weeks. If we need to see someone for a follow-up in, say, 6 months per clinical decision, we could book them into the next available slot 6 months from now. These bookings are really too far out for reliable planning, for many reasons, which we'll explain later. A clinician will decide when the patient needs to be seen. If it's under 6 weeks, this will be prioritised and booked immediately, with little chance of hospital cancellation. However, if the appointment is booked out for more than 6 weeks, these are the appointments that are at risk of rescheduling. However, with partial booking, there are two key processes. The clinician will set a target date and a method that's suitable for the patient. This could be video, telephone, or face-to-face. If the appointment is further out than 6 weeks, the request is added to a waiting list. And then 6 weeks before the appointment is to be arranged, we will notify the patient that the target date is approaching. At this point, we will ask the patient to contact the hospital to arrange their appointment and choose a date and time that suits them. You may be wondering why this is so effective. Well, 1 in 5 potential appointments in England and 1 in 4 appointments in Wales are cancelled or reported as DNA. And let's consider some of the many reasons that patients do not attend. The appointment didn't suit me. DNAs are frequently caused by this issue, yet it's rarely mentioned in clinics as the reason. It's certainly one of the leading causes of unnecessary calls and rework in booking centres, as we move patients currently booked into new time slots. And reaching the booking team can sometimes be frustrating, and it's not unusual for people to not show up because they couldn't reschedule. When we use the partial booking process, we give our patients more choice. It's usual that people know roughly what the next 6 weeks looks like, but harder to know their availability 6 months from now. I didn't know about it. A system of partial booking that is done correctly is proactive, which asks the patients to choose and confirm their attendance. This also ensures that we have the correct patient details. If we get no response from the patient, we can work together with the GP to ensure that this appointment is still required. And it could be that the patient has moved away or changed address, and we can update our systems accordingly. This will eliminate booking appointments which would never be attended. The appointment wasn't important to me. It's especially common for chronic conditions to cause non-attendance. Talking to patients can help them understand the benefit of going to the hospital, and if their condition has changed, we can inform the clinician who can assess their clinical need. Partial booking done well, with transactional decision-making with the patient, will solve many of the above problems, and even helps our trust to provide a more efficient service as well. In a trust, staff move on, clinics change, holidays get booked, and with a full booking system, these changes would result in clinics being cancelled and patient appointments being rescheduled. In a survey performed by Dr. Doctor, over half of patients surveyed had their appointments rescheduled at least once, and sadly for many, multiple reschedulings, which creates a poor patient experience and a system of complex administration. A partial booking system ensures appointments are co-managed with the patient to ensure the patient is seen at a time and date that suits them. This reduces the administrative burden and creates a better experience for patients and staff. Clinic cancellations can negatively impact clinical timescales within a full booking system. In the event of a cancelled booked clinic, either all the patients are moved further out, possibly several months, or a spike in the demand occurs. And recovering from these spikes can be challenging, and it can result in ongoing capacity issues or the need to run additional clinics, which is administratively and clinically very costly.